Should we wait for it?
What is,
Gonna
Amazon?
Amazon. Sponsored by Amazon.
Sponsored by Amazon helped me become a doctor.
I'm dead. Jeff Bezos.
Jeff Bezos.
My favorite memory with Jeff Bezos.
All right, hi. Thank you so much for taking the time to speak with us. If you could just introduce yourself for the camera, please.
Yeah, so hi, my name is Sheharbano. I'm a first year, now second year medical student at Stanford, and I'm really excited to be here.
Okay, great. Thank you so much. First question that we'd like to ask you is, what got you interested in medicine?
Yeah, I would say what got me interested in medicine was just seeing the impact the field had on members of my family, especially my grandmother. My grandmother, she's been a really important part of my life. She helped raise my brothers and myself, and from a very young age, I've viewed her as this very strong woman, and she was just always taking care of us, helping out. And, you know, over time, like she got older and she got weaker, and I saw that impact, seeing just how much like old age affected her. And I wanted to do something about it. I wanted to take care of her like she had taken care of me and my family. And so that's why I became interested in medicine. I wanted to learn how we can take care of people like my grandmother, who, due to old age, due to any other reason, their health starts deteriorating. And then I also had an opportunity to interact with diverse groups of people and see how inaccessible healthcare can be for different patients, for lower income patients. And I wanted to see what could be done in our healthcare system to make sure that they were able to get the care that they needed. So just hoping, I think medicine has a lot of potential. I think a lot of good can be done. And I really hope I can do, help push the field further to help patients like my grandmother, but then also other patients who may not always get the care that they need when they need it.
Please describe the type of doctor you would want to see.
Yeah, that's a great question. I would say I would want to see a doctor who is more than happy to take care of any patient, regardless of income, regardless of other factors. I think that's really important, and I feel like sometimes that type of accessibility isn't met, and if patients want to go see a certain doctor or in a certain specialty or at a certain hospital, they're unable to do so. So for me, I would love to see a doctor who's willing to take any patient to care for them. And I guess I would also want to see a doctor who's patient, who's willing to listen to the patient and take their questions and answer their questions thoughtfully. I think patience and just genuine interest in someone's concerns, someone's questions can do a lot. And so I really hope that's the doctor I get to spend time with as I, hopefully learn to become one myself, and then hopefully I become that type of doctor in the future as well.
Is there any life advice or comments, thoughts that you would like to leave with the viewers of this video?
I would say that for those people who are desiring to become a doctor or go into medicine, I would say just take the time to interact with people from different walks of life. I think that's what's really valuable. I think being able to understand where someone else is coming from, connecting with them on a cultural level, on a religious level, it's on so many different levels. I think that's what's valuable. It can make a huge difference in how that person views you, and I think one's perception of a doctor plays a big role in how and whether or not the care they feel they're getting is effective or not. So I think that's just one piece of advice for really everyone, but especially people who want to go into the field of medicine. So I guess one additional thought I had was, especially for those people who want to become physicians, just how important it is to recognize that patient care isn't doctor patient. It's so much more. It's not one-on-one. It's the whole team involved: nurses, medical assistants, people in the background who often don't get the credit that they need. And I think what I just really want people who want to go into the field of medicine and become doctors is recognize that while as a doctor you do play an important role, there's so much more. There's so many other people involved in the process, and it's important to acknowledge them, to recognize their efforts, be considerate of how much they're having to work, and just be humble about it. Oftentimes doctors can be on the upper end, healthcare can be a hierarchy, but I think one of the greatest qualities for any person to have is to be humble and to recognize that you can use the power and the influence you have to help those within your team, and ultimately help provide the best care to your patients.
If you could tell us a memory of your grandma for us.
I think the first memory that comes to mind is when I was visiting her in Pakistan. She worked there for a very long time. That's where she grew up, and she ended up working in like the education sector. Where it was like first like a teacher, a professor, and then ultimately became like an administrator. And she helped a lot of people. There were a lot of people who weren't able to get the education that they needed, especially girls and women in Pakistan. And I remember that when I was visiting her house, at her house, there was this lady who came in, and she was just talking about how grateful she is for my grandmother and what she did for her, because she paid for like her entire education, and now her own kids are like working in high-paying, well-respected jobs, and she would not have been able to attain that level of economic. She wouldn't have been able to climb up the economic ladder had it not been for all the work that my grandmother did. And so I think that memory really comes to mind because it just goes to show how selfless my grandmother is and how willing she is to give to others, even when she doesn't have to, but she does it out of the recognition that it's important to give to those who may not necessarily have that much. And I think that's something I've been trying to build within myself. And I think that's something that I really want as a physician as well, just knowing that there's so much more, and I want to be able to help all patients from all walks of life and give care to those, even the ones who may not get it. So, yeah.
It's a really beautiful response. Genuinely, I appreciate that.
Oh, thank you, Eric.
Your first year of medical school just ended. How do you think it changed you?
Yeah, so it did just end, and I would say it's changed me, both in terms of just how much knowledge I've gained. I think I've learned a lot about different aspects of medicine, cardiology, pulmonary, all these great fields in medicine. So I've learned so much, but it's also changed me in the sense that I've begun to love medicine a lot more after becoming a medical student. And I've been able to interact with patients. I've been able to shadow different physicians and see how they take care of their patients. And I've realized just how powerful medicine can be, how fulfilling it can be, And I think that is it's just really nice to know that I'll be able to go into a field where I'll be able to learn so much constantly, but at the same time, I'll be taking care of the patients in my community and from other communities and make an impact on their life. So this year's taught me that medicine is a very fulfilling field, and I'm just really excited to be able to explore it more in the coming years.
Such a wonderful response, and we're sure you're going to be an amazing doctor, and we're excited
Aww.
to see you grow, genuinely. Great. Thank you.
Thank you. Okay, when's